Our top story is COVID-19 cases are on the rise again in India. A recent Lancet study, important to mention, it hasn't been peer-reviewed yet, shows that people who were exposed to higher levels of air pollution in the beginning of the pandemic are now having low responses to vaccines and are getting reinfected with the virus. The researchers said that exposure to fine particulate matter, nitrogen dioxide and black carbon before the pandemic appear to have lowered antibody responses to COVID-19 vaccines, thus suggesting that air pollution harms our immune system as well. Now, the team of journal Environmental Health Perspectives analyzed the data from over 900 participants aged 40 to 65 years. They answered questionnaires and gave blood samples in the summer of 2020 and in the spring of 2021. All had received 1 or 2 doses of the main COVID-19 vaccines administered in Spain made by AstraZeneca, Pfizer or Moderna. Based on the participants' addresses prior to the pandemic, the extent of air pollution they were exposed to was also approximated. The study showed that pre-pandemic exposure to PM 2.5, NO2 and black carbon, it was associated with at least 5 to 10% reduction of vaccine-induced antibodies in previously uninfected people. Further, the study showed that the decrease in antibodies was both from IgM responses and late responses. The IgG response after the first dose peaked later in participants exposed to higher air pollution levels, and lower IgG levels persisted for several months after vaccination. Results were similar for other 3 vaccines as well. The fact that previous infections led to higher vaccine responses could explain why the effects of pollutants it was only observed in people without a prior infection. However, the role of long-term exposure to air pollution on immunity, that includes infection rate and vaccination, deserves further investigation as per the researchers here. To understand this better, we are now joined by Dr. Vivek Nangia, who is Principal Director and Head of Pulmonology from Max Super Speciality Hospital, joining us live from New Delhi. Thank you so much for joining us, sir.
Thank you, and very good afternoon to all our viewers.
My first question to you, recent study, like I mentioned, it shows that people who were exposed to higher levels of air pollution in the beginning of the pandemic, then now having low responses to vaccines. What's your take on this? And more importantly, does this imply an increase in severity of COVID?
So this is something that we've known always, that the air exposure to air pollution does reduce your immunity significantly. In fact, it is not just in people, adults, but it's also seen in children who've been exposed to air pollution outdoors. Their immune responses are very, very poor. They're very prone to developing infections quite often, especially respiratory tract infections, including diseases like tuberculosis, pneumonia, viral infections. So even there was a study which had shown that with every 1 cubic meter rise in the particulate matter, there was a proportional increase in the number of patients in particular areas. But this study has gone beyond that to show us that not just is the severity and the incidence of COVID related to air pollution, but even your immune response to the vaccines has been related to the air pollution outside. So that is really very remarkable study that they've conducted, where they've actually shown that the immunoglobulin, the IgM levels and the IgG levels, which are 2 types of immunoglobulins which are involved in the countering the infection, were both found to be their effect was found to be depressed as compared to normal individuals who are not exposed to the pollution levels. So that basically means that not only in the acute phase, but even the long-term immunity against the which would have been generated by the vaccine against the virus was not good enough. So it just reinforces our thoughts that yes, air pollution can have various damages on our body, and one of them is decreased immunity and making us more susceptible to catching infections. In fact, if you extrapolate it, you would also feel that maybe it is happening with other vaccines as well. So that is also a matter of concern now, and probably another subject for another study now.
All right, sir. Now, just for more clarity, how do you assess long-term exposure to this on efficacy of vaccines? And that being said, what measures would you say can be taken on an individual, also state level, to lower the potential risk that this poses?
Well, so this is all related directly to the air pollution levels. So I guess all the efforts that can be taken to reduce the air pollution should be taken to be able to develop our immunity. See, basically, air pollution not just affects the immunity, and not just affects the lungs, but it also affects so many other organs of the body, including heart, brain. People could have heart attacks, people could have brain strokes, people could have cancers of unknown origin, and if nothing else, it reduces your longevity as well. It reduces your survival time, the life expectancy also significantly. So we have to collectively move towards improving our air quality around us.
All right, Dr. Nangya, thank you so much for joining us on this broadcast with your insights on this.
Thank you.
WION is now available in your country. Download the app now. Get all the news on the move.